The sleeve gastrectomy limits the size of your stomach and the amount of healthy foods you can eat. The sleeve gastrectomy is a restrictive procedure which limits the amount of food you can eat by reducing the size of your stomach. To gain access to the abdominal cavity, small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to pass into the abdominal cavity. The surgeon examines the abdominal cavity using a camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form, so it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created using a stapling device. This sleeve will typically hold between 50 and 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold about 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed into the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance play a critical part in determining the long-term success of the procedure. As with any surgery, the sleeve gastrectomy has advantages and disadvantages. Here are some of the advantages of this type of weight loss surgery. There is less maintenance needed than the other surgeries. This surgery can be used as a 2-stage procedure with completion to gastric bypass or the duodenal switch procedure if health and weight loss goals are not achieved. There are no adjustments necessary with this surgery. While the sleeve gastrectomy is one of the newer procedures, initial results indicate a low risk of long-term complications. Malabsorption is not an issue with this surgery. There is also a minimal chance of dumping syndrome from processed sugar, and the risk for revision is low. Initial data show that patients are losing up to 83% or more of their excess weight, with 40% to 70% likelihood of diabetes improving or going into remission. There is less data available about the long-term results of this surgery than the other types of weight loss surgery. Some of the disadvantages of this surgery include this surgery is not adjustable and, more importantly, not reversible. Reflux and nausea are the most common side effects. GERD may be a long-term side effect.